For Global Medical News Network, this is Miriam Tucker reporting from the 2010 Annual Conference on Antimicrobial Resistance, sponsored by the National Foundation for Infectious Diseases in Bethesda, Maryland. I'm with Dr. Susan Foster, who's Professor of International Health at Boston University and also the Director of Public Policy and Education at the Alliance for the Prudent Use of Antibiotics. Welcome, Dr. Foster.
Thank you.
You spoke about the economic burden of antibiotic resistance. What are we talking about, and what kind of numbers are we talking about?
The burden, we have basically two types of burden. The direct medical cost would be the cost of longer treatment, more days in hospital, more expensive drugs, second and third line drugs, extra diagnostics that might be used, and other costs like that. And then we also have indirect medical costs, which would be out-of-pocket costs that patients would pay, lost wages, the cost of, if someone dies, the cost of mortality, all the stream of lost wages into the future for where they would have worked, and so on. So we have two types of economic costs. And what we're finding is, as I mentioned, the costs of antibiotic resistance are dramatically increasing. From 2000 to 2007 in Massachusetts, the cost nearly tripled. And the other thing that we're finding, which I think is of interest, is that over that 7-year period, the cost has shifted from older patients, and therefore the burden was primarily on Medicare, towards younger patients who are still, less than 64 years old. And so the cost burden is also being shifted onto private insurers, HMOs, and so on. And I think there's lack of awareness of that. I don't think the health insurance industry has really caught on to the fact that they are paying a lot of money for antibiotic resistance. And our cost data, we have data from the Chicago study, which I reported on. This was a study carried out at the Chicago Cook County Stroger Hospital, where they estimated the burden on that hospital alone was something on the order of $15 million in 2000. And taking those data and extrapolating them into the current time, into 2008 or 2009 dollars, we would find that the costs would be somewhere on the order of between, depending on which adjustment you use for inflation, between $21 to $34 billion, or as high, if you use medical inflation, between $24 and $38 billion. And this is just for hospital costs. This does not take account of ambulatory care, outpatient care, and very importantly, it doesn't take account of nursing homes, long-term care facilities. These are just cost data from acute care facilities in Massachusetts. So this is just a small tip of a very large iceberg. And we're working on getting better estimates. It's a little bit difficult because the data are not collected in a way that make it very easy to understand what's really going on. But it's pretty clear, to my mind anyway, that there's been a pretty sharp increase in the economic burden of antibiotic resistance in the last 7 to 8 years.
Thank you so much, Dr. Foster. I really appreciate your time. For Global Medical News Network, this is Miriam Tucker reporting.